Having an abortion is complicated for anyone, anywhere. But imagine being here, in the north and in jail. One of the physicians working at this jail told me she's seeing significantly more female inmates over the last 3 years. It's actually something that's happening across the country. It's something researchers are looking into. The report says without a clear policy or plan, when it comes to incarcerated women, their care can get wrapped up in layers of bureaucracy.
You can think of all the different types of delay you can have. The person who doesn't know if they have a right to this and so hesitates before asking for it. The person they ask doesn't really know the answer and takes it up the line. And the person up the line doesn't really know the answer because they're justice. And that's sort of a health question. And so they take it over across and et cetera, et cetera, et cetera. Eventually it gets to the Opal Clinic who say, okay, well, sorry, but you've taken so long that now we no longer can offer you services and we're going to have to fly you south. So that's the danger.
That danger can include health complications. The researchers asked all 3 territorial governments about their policies and procedures when it comes to accessing abortion and reproductive services. The Yukon said there's no record of any women inmates having given birth while sentenced or remanded to Whitehorse Correctional Center. As such, there's no set policy or protocol that deals with such an event in Yukon. We reached out to the Yukon government to see if anything has changed since the study was published. They said they had nothing to add. The GNWT also doesn't have a formal policy. Officials told CBC pregnant inmates would be referred to Health and Social Services. Nunavut does ensure inmates have access to treatment during a medical emergency. It says this would include procedures such as a planned or unplanned termination of pregnancy, but its policy ends there. So is that enough? Several advocates say when it comes to stigmatized healthcare like abortions, correctional facilities should have clear and specific policies. The Reproductive Justice Project believes policies are the bare minimum.
Having a policy that outlines exactly what's available, what needs to be made available, would be a huge benefit to people who are incarcerated, so they know what they can ask for.
Researchers say collecting more data could help governments better understand the issue and ensure they're offering dignified and humane care. Caitrin Pilkington, CBC News, Whitehorse.